Hi, it's Abienvenu again. In the last video, we discussed blood administration, the procedures for blood products, and the patient identifications. In this video, we will talk about the ability to pick up the signs of a transfusion reaction. We're going to roughly talk about the most complex or the most common transfusion reactions. The first one we're going to talk about is acute hemolytic reaction. This one is common because of healthcare professionals. It's a human error, basically. So if the patient received the wrong blood because of a step we missed, whether they didn't get the correct label to the armband, or it was mislabeled on the bag, but we said something else, or XYZ. It's a human error. And usually the symptoms for that one would be, say, fever, chills, back pain, tachycardia, hypertension. That one is something that usually does occur. I mean, we in a perfect world, we would say it doesn't exist. However, it happens. So we need to be really cautious, taking the extra step to making sure that this is the correct patient, the correct medication, making sure that all these things are correct. This is the correct fluid. We discontinued that fluid because it's not compatible with the blood. You want to make sure that normal saline is the only fluid that you can flush the lines with. When the transfusion is taking place, you only allow the blood to flow in. There should be no other fluids mixing with it, or it shouldn't be a Y. I mean, there should be a Y, had the normal saline and the blood, but the blood should be running in by itself. The other one should be on hold, and throughout, say if there was a reaction, the first thing you need to do, we were taught in school that you stop the blood. You stop the blood because if you notice a reaction, then you don't want to keep putting more of the cause into the patient's body. So the next one we're going to talk about is the febrile reaction. That one is very common. 1 in 8 transfusions have a febrile reaction. And the febrile reaction is a temperature rise of 1.8 degrees Fahrenheit, or 1 degree Celsius from the baseline, the initial vitals you took, compare it to that. It's very common, so just be aware of that. Also, you can see hives. Also, with the hives, you may see a kind of a trend to more laryngeal edema, bronchospasms. That one is a little less common. It's about 1% of people receiving blood transfusions. Another one that's very severe is allergic anaphylaxis to the transfusion. It can involve your respiratory involvement, causing dyspnea or stridor. This is a medical emergency, the anaphylaxis. Anytime you have a situation like that, it trumps the purpose of the transfusion. If you have an anaphylaxis reaction, that is going to become your primary goal to treat now. Because if we don't, and we focus on the blood, then there's no point. If the patient can't breathe and oxygen is cut off, what's the purpose of the blood? What is that going to do? It's not going to do anything. So you got to make sure that your focus changes from the anaphylaxis reaction. Another reaction could be volume overload, whether the patient has, say, CHF or something with the heart or kidneys. We got to make sure that the right rate and the amount of volume the patient can handle. The next one is a bacterial contamination. The signs and symptoms for that one can be hypertension, shock, fever, chills, nausea, vomiting, respiratory distress. That one is really, they say rare, but I just wanted to touch on it because it is a possibility. Hypertension is another adverse reaction. If the patient's blood pressure drops less than 10 in systolic or diastolic arterial blood pressure, you want to make sure that you stop, again, any of these, you stop the transfusion from continuing and you start treating all of these. In this video, we're not going to talk about the treatment. I'm just going to talk about a rough overview on the transfusions, reactions. The next one is the graft versus host. You may see a rash, fever, diarrhea, and this one here is quite interesting. It's 3 to 4 weeks after the transfusion. So we have to educate our patients that it's not just something that's going to be right now. After you get your transfusion and everything's fine, you still need to take precautions for the next 3 to 4 weeks or longer, because the possibility of a reaction can still arise. And educating our patients what to do in that situation. There is also, the next one is a non-immune hemolysis. That's another one that's rare. This next one is the PTP, thrombocytopenia, that is frequently profound with the little dots, little purple area, or bleeding. That could also be linked to febrile reactions. It says febrile reactions have been reported respectively with the implanted transfusion, so definitely watch that there. But your main one that you really want to watch is, I would say, your fever. Fever, making sure that the baseline is, making sure that your baseline vitals are accurate, because you have to be able to compare it to something. So say if your patient is 15-minute vitals and it goes up like we said earlier, and what do you do from there? Again, you stop the transfusion now, immediately. You don't put more into it. And I know I'm reiterating that, but it's so important, because if you're sitting there and you're focusing on, oh my goodness, what's going on, you start assessing the patient, but the cause is still going into the patient, there's a problem. So you got to make sure and stop the transfusion. You want to disconnect the line completely away from the patient, and you don't want to discard the bag of blood in the lines just yet, because there may be a problem within that. Within the bag, they may be, like we talked about contamination earlier, it may be mislabeled. That is our proof. You never want to get rid of that for the time being until it's fully investigated and to see what the cause was for the reaction. You make sure that all of this is documented in the chart to make sure that you're covered, that you went above and beyond and did the best of your ability to make sure that your patient was safe, and that you just made sure that the patient is okay with all aspects of life. Make sure that literally every aspect of it, the whole deal, was covered, and that you made sure that every check was there, made sure that the blood bank, when you went down there and you read it back and forth to each other, that step was taking place, and that there was numerous checks throughout before the patient received the blood and a reaction occurred. We're not going to get into the treatment of transfusion reactions, but that would be definitely the next thing immediately, is to stop it and let's treat it. So before I end this here, there may be a time where it outweighs the risk or it outweighs the reaction. Say if the patient comes and it's a medical emergency, they have to have this transfusion, but the patient gets a little itchy, or if the patient has a previous reaction to it, but it was very minor. Well, it's a life or death situation if they don't get this blood transfusion now. We'll be able to treat the little itchiness if it doesn't progress to something, say, like anaphylaxis. If it's not a minor reaction, we're going to outweigh the risk and we're going to proceed with the blood transfusion. And that's not my call. That's going to be a physician's call. But I do want to mention that in this video for the video purposes because that's really important. Because you don't want to get in a situation where you see that there was a reaction in the past, but it says continue, and you're like, okay, well, why? Why am I doing this? They're allergic to it, But if the physician orders it, and if it's something, don't just follow the order because the physician says. That's not what I'm saying. I'm saying that if you are educated in that area, that that what's taking place, you clarified it with the physician and you say, I'm aware of the reaction, but it's a minor reaction, and we're just going to watch it closely, but continue the transfusion. Just be aware of that situation, and that's pretty an overview of blood transfusion reactions and blood transfusions or blood components, making sure that you cover all of your grounds to protect your patient to the best of your ability. Thank you so much for watching. My name is Abienvenu, and have a good day.